CareAsOne is committed to providing a unique virtual collaborative experience for healthcare professionals to come together to exchange information about U.S. healthcare through collaboration, conversation, and knowledge sharing. The Future of Health podcast provides a true infotainment service that helps the industry innovate by sharing expert voices, views, and advice on the important issues of the day. And now here's your host for The Future of Health, Dipty Desai.
Hello, everyone. Welcome to the Future of Health with CareAsOne. I'm Dr. Dipty Desai, the director of CareAsOne and the host of this podcast series. For those new to CareAsOne, it is a large virtual community that jumpstarts innovation acceleration by bringing together various stakeholders in the care cycle, from providers to payers, pharma to clinical researchers, startups, investors, universities, and more. The mission of CareAsOne is to truly accelerate innovation by creating a connected healthcare community where the patient is at the center of care. The entire ecosystem comes together through knowledge sharing with the help of healthcare luminaries and thought leaders to discuss the challenges, gaps, solutions, and transformations essential to make healthcare whole again. The interaction and the networking between the stakeholders is made possible through summits, webinars, roundtables, leadership circles, and podcasts. In today's episode, I will be talking to Dr. Matthew Kroh, the Vice Chair of Innovation and Emerging Technology at Cleveland Clinic. Matthew really wears multiple hats as he also specializes in advanced surgeries of the gut, including laparoscopic, endoscopic, and even robotic surgeries. Dr. Matthew Kroh is committed to clinical excellence and patient-centered care with a particular focus on surgical and endoscopic innovation. In addition, he chairs the Digestive Disease Institute at the Cleveland Clinic in Abu Dhabi. So welcome, Dr. Kroh. It's a pleasure to have you here today.
Hi, Dipty. Pleasure to be back.
Yes, I mean, it's always very interesting. Every time I talk to you, I always learn something more. But it would be good for our listeners to hear about your journey too, and how it brought you to the role that you play at Cleveland Clinic. So can you take us down your professional path and what you do at Cleveland?
Absolutely. So I'm a surgeon by training. I specialize in esophageal and gastric surgery with a particular interest in less invasive ways of operating on the gastrointestinal tract. And that includes laparoscopy, robotics, and endoscopic surgery. I'm a professor of surgery at the Cleveland Clinic Lerner College of Medicine, and I'm the vice chair of innovation and technology here at Cleveland Clinic in the Digestive Disease and Surgery Institute. Most recently, I came back from Abu Dhabi at Cleveland Clinic Abu Dhabi, where I was the chair of the Digestive Disease Institute there. We had a chance to open up a tertiary referral academic medical center in Abu Dhabi and the UAE. And now I'm back in a different role in innovation here at Cleveland Clinic in Northeast Ohio, and wearing multiple hats, as you said: active clinician, surgeon, researcher, and innovation director in our clinical institute.
Yeah, that's so impressive. And like you mentioned, that you played a number of roles and the roles keep evolving. And COVID-19 has actually created a huge transformation in the healthcare systems too, right? It's created a critical need for reliable, accessible telemedicine. And the use of telemedicine has skyrocketed in modernizing healthcare for both the patients and the providers. Many hospitals are adopting to this video conferencing to improve accessibility to healthcare, especially when the patients can't come to the clinic, right? So can you share with us what that looks like? What does telemedicine look like at Cleveland Clinic? And what is your thoughts? What are your take on telehealth, telemedicine, even telerobotic surgery?
Yeah, those are fantastic questions, and we could spend a lot of time talking about each area. But I'll answer in two ways. One, as a perspective in a tertiary referral academic medical center with multiple hospitals across Northeast Ohio in the United States, but also in the UAE, where I was before I came back to Cleveland in the midst of the pandemic. So telehealth has given us a unique opportunity. It has accelerated the way in which we utilize technology to interact with our patients. Obviously, it was born out of COVID-19. A lot of those technologies were relatively nascent when we started. There were many hiccups along the way for patients and providers to use these new platforms. But obviously, they got better and they got better quickly. They are here to stay. Obviously, the pandemic hasn't completely subsided, unfortunately, but those technologies have become much more refined. What's going to be fascinating is how they stay a part of our patients' access to a healthcare system and what that means outside of a global pandemic. And one way in which this was immensely helpful at the beginning of the pandemic when I was in the UAE, and we had patients that came from very far distances, not just the Emirate of Abu Dhabi, but throughout the Middle East and Southern Europe and Northern Africa. It was an entree into our healthcare system. It was a chance for patients from very far away who physically couldn't be there to access Cleveland Clinic care, at least initially, for an initial discussion as to, was that patient even in the right place? So, traditionally that triage might have been done at a lower level, but now you had access to a subspecialty doctor that could at least begin a conversation. And if it seemed like that was the right next step, then we figured out how to make that work. Now, fast forward months and a couple of years into the pandemic, what does telehealth look like in Northeast Ohio and the United States currently? Well, it also gives access to our patients. And yes, they may not be traveling from multiple countries over, but there may be limitations as to why they can't access our system. They may be in a wheelchair. They may not have a ride to get here. There may be challenges to even obtaining transportation or paying for parking in our facilities. These are all hurdles that prevent access to healthcare. And if we can remove some of these hurdles, we can allow access to our care easier in a manner that is more acceptable to patients based on potential physical limitations. As a surgeon, sometimes that means it's just hard to get to the hospital after surgery. Even with minimally invasive robotic surgery, it's still painful. And it may be easier just to do that consultation via telehealth, or at least a triage. And if they need to come in and see us, great, we'll figure out how to make that happen. But there's more touch points, there's more opportunity in ways that patients can access, and ultimately that's our goal.
Yeah, and scheduling becomes so much easier, right? I mean, in order for the patients to see the doctor for maybe 20 minutes, they have to spend time to get to the hospital. They have to spend time to get back home and go get the pharmacy. But with all of the telehealth services available, I mean, it's really amazing how much the doctor can do while you're sitting in your home or wherever you are while you're waiting for the doctor, and don't have to sit in a waiting room over there. And Cleveland Clinic is really a very unique kind of a hospital, right? I mean, it's like one of the best hospitals in the world. People from all across the world want to be seen by doctors at the Cleveland Clinic. So it's actually an academic health center, but it also plays a very important role in educating the healthcare workforce and conducting innovative biomedical and clinical research. At the same time, it delivers high quality patient care, as I've seen from you many times. And I want to talk to you, you're in a surgery, right? You're trying to take care of all these complex cases. So Cleveland Clinic has a tripartite mission for clinical care, for research, for education. And these goals and outcomes are quite different. So how do you guys make it work together? How do you handle that? I mean, what are the strengths when you're having 3 different goals and you have to try and achieve them all? What are the deficiencies that you encounter? And how do you manage it all? How do you transform your organization and help overcome many of these issues that come about?
Yeah, you're absolutely right. All 3 of those areas, delivery of clinical care, education, and research, seem to be disparate, but the values to do well are intertwined. In order to deliver the best care, we have to continue to research to make sure that we can bring health and wellness to our patients in the future. Additionally, we have to train a workforce that will continue to deliver world-class care. So as we deliver clinical care, today's technology, therapeutics, surgical interventions, we have to make sure that the next generation is there too. At our side are our trainees, our students, our residents, our fellows, the future of healthcare delivery, not just at the Cleveland Clinic and not just in the United States, but around the world. And that's in the immediate future, 1 to 5, 10 years down the road. But some of that groundbreaking research is being done in the innovation labs or research labs on this campus, whether they're chemical therapeutics like drug delivery, novel treatments, new technologies for the operating room. All that's going on simultaneously. And the drive to put patients first is at the base of all of those activities. So they're more intertwined than you think. And working at a place like the Cleveland Clinic, it's a wonderful opportunity to move between those 3 areas during the course of even a single day.
Yeah, I mean, and essentially at the Cleveland Clinic, there's been many firsts, right? The first probably bypass or the first transformation of technology use, etc. And I mean, you know, you yourself are constantly in transition or evolution, right? It's a healthcare evolution. You were a surgeon, you became an innovator, you have all these multiple interests with robotics, and there's more and more happening in terms of robotics, robotic surgeries, etc. So how do you personally also manage all of these different roles and hats? How do you balance your work from being a vice chair of innovation and technology to handling surgeries at Cleveland Clinic?
Well, as you know, it's all about team. All these efforts are team-based, and there's a wonderful team in each of those areas that I get to work with. But fundamentally, how do those teams go? How are they intertwined? And how do we get to that, to accomplish that mission? One of it is putting the patient first at all times, patients first to deliver quality, safety, and experience, but also a curiosity to do better, to look at problems, whether that's in the operating room. Is there a better way to divide and seal tissue? I mean, that's a very simple example, but that drives a lot of innovation. And sometimes they're simple tools. Sometimes they're ways in which we deliver healthcare, like initiation of robotic surgery. Sometimes they're paradigm changers, like getting rid of instruments altogether and deploying magnets within the abdominal cavity and using external manipulators. Then you bring that same curiosity to research, which is also an important part of what I do. We look at the data that exists. We're trying to decide whether a treatment for a patient is correct or not. We look at the literature. There's a deficiency in the literature. Sometimes uniquely, being a national and international referral center, we see many patients with rare diseases. It gives us an opportunity to bring a level of curiosity and research to see what outcomes have done best for those patients and how can we do better. And then you can also spin that to innovation, not just for device development, but care delivery. How can patients access our system better? You know, maybe it doesn't fit within a Monday to Friday work week from 9 to 5, just because that's what's simple for us. Because if patients have jobs, it may not be convenient to take time off. How can they access care outside of the normal clinical boundaries? So I think curiosity, putting patients first, and a drive to do better allows us to rethink all 3 of those areas. So some of those principles are similar regardless of which domain I'm working in at the time.
Yeah, no, you intertwine them beautifully, right? And you mentioned something very critical, that you use technology. I mean, technology is being used to impact your operational efficiency. And that use is only growing, right? As more and more data is getting collected and you're bringing more of this information together, right? And I would like to talk a little bit about that. Like, how are you using this technology? What are the breakthroughs that you're seeing over there? What's new? What's exciting? And what do you think we need to still do for care to evolve and become better with the use of these innovative technology solutions?
Well, just like solving a scientific challenge, data is always going to drive our decisions. Increasingly, we have better data acquisition about how patients access our system, where they're coming from, what they've been through before, and how we can deliver care to them in a more efficient, better way. Cleveland Clinic has high utilization from other facilities, not just primary access, but if patients are coming from near and far, having seen many physicians before, they may have very specific, sometimes unusual, sometimes not unusual, questions and problems that they have. how can we make that more efficient for them once they are here to get an answer that makes sense? And that can be very challenging. That may not be simply in my domain, but as an innovator looking at access to our system, if a patient travels a long distance to come here for a complex problem that may involve multiple caregivers, how can we make that discrete period of time that they are physically here most efficient for them to deliver care that's appropriate, to give them an answer and next steps? And then how do we continue that care if they go back home? They may or may not have a surgery, they may have an intervention, but how do we follow to make sure that that care continuum exists, not just in that discrete encounter that we have here? I think historically we thought, okay, they come in, they may see me, they may see some other caregiver in the organization, we delivered the right therapy, and they go, and we may or may not see them again. But as we know, the lifetime of an individual, the lifespan of a particular disease or disease process needs to be evaluated. So all those data points are critically important. Technology is allowing us to capture these data points, to be more introspective, to make sure that we're doing a good job delivering quality care, not just at that initial encounter, but over the course of that patient's lifetime. And when we see deviations, how do we alert them to come back and say, all right, that initial plan of care has now changed. We're going to change course. We're going to give you a different direction. We're going to give you a different therapeutic, a different treatment to improve your quality of life.
Yeah, no, that's so true. I mean, patients see different doctors across. They may be visiting and they may see a doctor there. They come back home. They need that data to be transferred to where they're being seen at that particular point. And like you mentioned, there's all these chronic conditions where patients have longitudinal history, and all that data needs to be collected. How do you make that happen? Is that now a reality, or is it just the luxury of some premier institutions like Cleveland Clinic? I mean, do you think that we have true interoperability, or how long do you think it will be before health data is truly interoperable between and across health systems?
It's a great question. And I don't think anybody's answered that completely. Even with our own system, there are challenges to make this interoperable. You know, we have more than 20 sites in Northeast Ohio. We have footprints in Florida, Las Vegas, Toronto, Abu Dhabi, and London. And even working within those diverse systems, it's hard to exchange efficient data for patients that travel geographically. And then you look at different systems. So that's just even within one system. How do we look at interoperability across Cleveland, Ohio, across the state of Ohio, across the Midwest, across the United States? I think that's ultimately going to be the goal. But we have to be, there's caveats to that, of course, right? We have to make sure that patient identities and protected healthcare information is carefully guarded and exchanged in an appropriate manner. We have to make sure that patients consent to having that information disclosed. We all want that data because we think that we can deliver better care, but it has to be done in a safe and judicious way too.
Yeah, yeah. And then we're just talking about within the US, and then you have the complexity of international footprints, right? So going back to the fact that Cleveland Clinic is present in Canada and London and Middle East, got a presence across the world. Again, different countries have different policies and different access to patient data. So how is that dealing with these different countries, different cultures, different systems across the world? What do you see with the Cleveland Clinic, and how do you manage all of that as you go across the world?
Yeah, well, even within our system, there can be challenges that because local laws, disclosures, and information transfer has different expectations, behaviors, and legal ramifications. So we have to be cognizant of those at all times. Part of the advantage is that as a national and international healthcare system, that at least within the caregivers, there's easier communication, and we are partners, even though we are in disparate areas of the world. So there is a degree of interdialogue that occurs for clinical care, but as we talked about before, also for research and education. So it allows us to deliver that quality of care with physicians, nurses, APPs, and any caregiver that is connected by that system. That systemness allows us to deliver equivalent quality of care at disparate sites worldwide.
Yeah, and think about that. Everything is constantly evolving and changing, and innovation is at the center of that. And you play a big role in using and evaluating these innovative technology solutions. So, any solution that you see today that you would like to highlight, or you say, oh, wow, it's so good to have these kinds of solutions out there, or anything that you don't see that you would like to see out there?
I'll answer your question, but I want to put it in the context of innovation. So as you and I know, innovation can be applied to so many different areas. As a surgeon, you might think, well, there are technical problems in the OR. How do we innovate to make specific surgery safer, better, more efficient? That's true. That's innovation. But innovation can also exist in a lot of other diverse areas too. We can innovate in access, we can innovate in patient experience, we can innovate in research, we can innovate in global connectivity, we can innovate in the new digital revolution, digital surgery, image capture, segmentation, application of AI and deep learning algorithms that have implications for safety, quality, training. All of those are spectacular and to varying degrees will impact healthcare in the short and long term. I think one of the most exciting areas is access. Obviously for certain types of healthcare delivery, at least in the short term surgery, you have to physically show up to have it done. Though we did mention telerobotics earlier, which may be an opportunity to do that at a distance, but accessing the healthcare system in different ways, in off times, throughout the night, in different time zones, with different caregivers of different degrees, at times appropriate to patients. And that's not just physical time during the day. It could be at the night, could be in the morning, but it could be for more episodes for shorter periods of time. Maybe it's a 3-minute consultation on an update about how to use an incentive spirometer about surgery. But maybe that patient will access the healthcare system 15 times over the course of 1 week for an average of 2.5 minutes, as opposed to a 30-minute consultation in a room sitting one-on-one with me. So there's a lot of opportunity to change the way in which we interact and the types of interactions that we can have. That's the most exciting. And I think that'll be the most change in the next 3 to 5 years.
Yeah, so more interactive between the patient, the doctor, the hospital system, and then more continuous as opposed to just episodic, like you were saying. And that's how you see it evolving. And where do you see, if you had this wish list and you could say, okay, this is what I would like to see in the future, where would you see the future go for healthcare?
Well, healthcare will be, to some degree, virtual. It'll be protected, secure, accessible by patients and caregivers. It'll generate big data for quality, safety, patient experience. It'll allow us to look at that data for continuous improvement, ourselves better, parent reporting of outcomes, and all of us at care to know how we're doing better. Data us to do that.
Data is key to healthcare, driving down the cost, driving better outcomes, more. Our listeners are professionals in healthcare, they're executives and there are startups that are creating for healthcare. Do you have any closing for our listeners? Anything that you?
Healthcare is always innovative to do more in different betterment of our patients. Mantra of healthcare. We say Cleveland Clinic, patients first. Mm-hmm. Innovation now is now being applied to areas that maybe weren't being applied as aggressively, and it's an exciting time, enthused by the way in which it's making us help deliver better care, and that's only great in the immediate future.
Yeah, no, thank you, Matt, for taking this time to talk to us, to chat with us, share your knowledge with us on the multifaceted role that care through and infusion of technology. That was so knowledgeable session for me, and I'm sure for the audience too. I'm sure your advice is going to stay with us through the transformation journey of the healthcare sector. And to the audience out there we have with us, thank you for listening. Don't forget to check the show notes. Links and resources and contact information can be found there related to today's show. Stay tuned for more CareAsOne podcasts and discussions on trending healthcare topics that you care about. And send in your suggestions on speakers and topics that you would like to see, and we'll try to address them. Thanks all and have a great day.